Hello and welcome everyone. I'm Dr. Hailey Nelson. It's nice to have you joining us today with Safe Kids Central California. I'm a pediatrician and a mom of three, and my kids used to talk about how I worried a lot. And I worry because I know how kids can get hurt, and I want to be able to help prevent injury and illness, which is things that pediatricians love to do. So today we're talking about lead poisoning, and that might be a topic that you're not as familiar with as opposed to bike helmets or some of the other things we've talked about. We brought in our expert. I'm going to let her introduce herself and tell you a little bit more about the topic of lead. So if you'd like to introduce yourself.
Yes, hello everyone. My name is Valerie Martinez. I am a health education specialist with the Fresno County Department of Public Health.
Okay, so Valerie, like tell us in terms of lead poisoning and lead exposures, how prevalent is that in kind of the Central Valley? How many cases are we seeing around here?
In Fresno County, we are seeing cases that we consider state cases, that is with blood lead levels over or 14.5 and above. And we have about 53 currently, but the ones that are 5 to 9, those are, hold on, let me look at my notes. We have 694 children that are 5 to 9, and that's still considered a level of concern for us. So we do monitor those children by making sure we're sending letters to parents and reminding them to get that follow-up lead level, just to make sure that it's not as high as it should be. It should not be higher than 5. It shouldn't have consistent levels like that. It should be lower.
Yeah. So as a pediatrician, we check lead in the office when your child comes in for a well child. So both at 12 months and at 24 months. So that's the little finger poke that happens, as well as screening for anemia. But in that finger poke, what I'm looking for on our machine is a level less than 3.3. So we're talking numbers, a lot higher. So there's children that are being monitored, as well as children that are in kind of the more dangerous zone.
Yes.
Lead. Okay.
The dangerous zone, we have our public health nurse, like that is greater than 14.5 or consistent lead levels that are 9.5, that are constantly 9.5, then they become a state case for our public health nurse to monitor. And so she will be going to the home. We also have an environmental health investigation team that goes and investigates the home for any sources of lead that might be in the paint or the soil. We have a lot of older homes in Fresno County, so we do see a lot of older homes that are built before 1978 with still lead-based paint. And when it's hazardous is when it's peeling and chipping.
Okay. Yep. That was going to be my next question. It's kind of where are kids getting into lead? And so if you're in an older home,
yes.
And that paint is chipping, probably also if there's construction going on, because that might then kind of bring things up. What are some other places that children might encounter lead that families should think about?
So families should think about imported food also. Ceramics, so like those ollas that people use, in the Mexican culture, those types that are made from clay, and they call them de barro. So those ones are usually have high amounts of lead. So we tell parents not to cook with those. Other sources would, like I mentioned, the soil and the paint. We do have cases of like imported using like home remedies for when like the children are sick or colicky. Sometimes those home remedies might contain high amounts of lead because they're getting them from other parts of the other countries.
Okay. Yeah, so different places that you can get it. And we have a question coming in from social media wanting to know how prevalent this is in the Central Valley. So do you know, compared to other places, like how do our numbers
so how prevalent? We are considered the third highest county in California. So Fresno is up there. So the other counties, I'm pretty sure is LA, but I do not remember the other one. I'm sorry, I could get back to you on that one. But Fresno County is considered the third highest county in the state of California.
Okay, so we're kind of at the top of the list, and that's not a list that we want to be on.
No,
that really means that children can be endangered by this. So do you want to talk a little bit about what are the signs, like what happens with lead poisoning? Kind of educate us more about that.
So what happens, it is kind of hard to tell, like the symptoms can mimic other illnesses. So, and a lot of our cases don't have symptoms at all. The effects would be kind of long-term. If they're constantly being exposed to lead, that can really affect the brain development and growth. So you will see that probably later on in school when they're trying to learn, it's going to be more difficult for them to learn, and they'll have behavioral problems as well.
Okay, so things as a parent you want to avoid
Right,
impacting your
right.
child's ability to learn, or then having to deal with
Yes.
behavioral issues because your child had lead exposure. So again,
Lead
it's
exposure.
why we're screening, and why not only through your pediatrician, but
Yeah.
also if you go to WIC, I know that that's on their form as well, and so they're
Yes.
kind of monitoring those children who need those services, just to ensure that we're catching it early. So what are some
Right.
of the treatments if those numbers do come back? Kind of, you mentioned a little bit about how we have nurses that go to the home, that they're looking at the environment, trying to figure out where the lead was coming from. But then what do we do for the actual child?
So the actual child, when we do have cases that have higher amounts of lead, if it is over 45 micrograms per deciliter, then we would have them do the chelation therapy. So that would be going into the hospital, and they would have to take it orally. I think it is intravenous too, IV through IV. But if it's less than that, we try to encourage a healthy diet for the child. That's the only way that it's going to help get that lead out of the body, is with like a high diet in vitamin C, calcium, iron, just making sure that child is getting those nutrients to help get the lead out of the body.
Sure. Okay. And for the parents who heard that medical term, so chelation is where we give a medicine and it binds to something else to help get it out of the system. So that's essentially what we're
Yes.
doing. If a child's numbers are too high, we really want to be able to bind to that lead and then get it out. But if we're not at that point yet, what I'm hearing is that really it's paying attention to the diet
The
as
diet,
well as then we got to stop whatever the
exposure.
exposure is. So we got to get
Yes.
rid of that.
Yeah, so we encourage, of course, like hand washing constantly, because, of course, these children, we do have a lot of cases of children that love to eat dirt, unfortunately, and there can be lots of lead in dirt. So just making sure your child isn't eating dirt, that pica behavior, anything, that might have lead, and just making sure they're washing their hands right after they play outside, before they eat, just make sure they're constantly washing their hands and cleaning the home. If you do live in an older home, you want to make sure that it's not, so dirty and dusty, but you want to wet wipe it down. Don't sweep, because that can put the lead in the air, and you can also breathe it in that way.
Oh, interesting. Okay, so instead of sweeping and kind of mopping, using
Mopping,
wet things so that we don't
yes,
bring it
damp
up into
cloths,
the air.
right?
Okay.
Yeah,
And then that hand washing too, which
yes,
we've all learned during the pandemic and we
yes.
need to continue to do
Very
for multiple
important.
reasons. But here's another one. It's going to prevent you possibly increasing your lead exposure if there was lead in the soil when you were
Exactly.
playing. Anything else that you want to let parents know about lead as they're thinking about this topic?
Just, be aware of lead sources. We do have materials that we can provide for people, like kind of like checklists to see what if you might have lead around your home, and just kind of try to keep your children away from those things, because it can be found in things that you won't even realize. It's like, oh, I didn't know this had lead in it. And just
Yeah.
making sure that if you suspect your child is might be lead poisoned, or they got into something that you suspect has lead, ask your doctor. Try to get that test. Even if they haven't had it done, they can get that test, all the way up until they're 21 years old, especially if you are in like Medi-Cal program.
Yeah, and the test is easy to do. So we're not
Yes,
talking about anything too invasive. Again, it's just a little finger poke
little
to be
finger
able to
poke.
check and see
Yes,
what that level is. So it's important to think about. And again, if you have questions or concerns about lead, this is the time to call your friendly pediatrician. That's what we're here for. So as you evaluate, we'll post the list when we link this video so that families can see. So if you're wondering whether or not there's lead exposure risks in your home, we'll share that list with you, as well as kind of evaluating, how old is my house and what other places might my child come into contact with lead. So
yes.
really great tips today. Thank you so much for joining us. I really
Oh,
appreciate
thank
it.
you.
And
Thank you,
I'm glad that
Dr.
everyone
Nelson.
else was able to watch today. I hope you learned something about lead poisoning as well as prevention. And key thing, wash those hands when you've been playing in dirt. I love that. It's washing hands is something that we can't say enough from a public health standpoint. So please like and follow us on Facebook for Safe Kids Central California. That's where you're going to get all of our updates. And we will be back with more content. We've got a full calendar for you. We really enjoy doing those. So for everyone today, I hope you stay safe and be well.
Bye, everyone.